It's Dr. Ted Grellner. I'm coming to you from New Orleans, Louisiana. I'm sitting in front of a fountain that I passed the other day that caught my attention. It's the La Meridian Hotel in the Garden District, right across from Harrah's Casino. I had a short message I wanted to share with you, something I learned at attending a weekend course here that was for oral surgeons, pearls of oral surgery. One of the topics was that of impacted wisdom teeth. And it deals with an experiment that the British public health system conducted for about 10 years, where they decided not to pay for the removal of impacted wisdom teeth on their patients unless they were already diseased. You know, they might have a cyst associated with them. Perhaps they had a second infection associated with the teeth. You know, perhaps antibiotics got rid of it the first time, but it came back again. That's kind of like getting a strep throat multiple times. So at that point, they would pay for it. Well, the average age of the wisdom tooth patients when they started this was 25. They ended their experiment 10 years later, and of course, the average age of their wisdom tooth patient at that point was 35. And the result was they were ending up taking out just as many wisdom teeth at 35 as they were when there were no restrictions on them 10 years earlier. So that tells me that indeed problems are arising from wisdom teeth over time, where many people are losing the gamble with their wisdom teeth. They gamble that they're not going to have problems with them, you know, regardless of whether they come in or not. And they end up paying the price, having those teeth removed at a much older age when things are a lot tougher and riskier. There's one group of patients I've found over my 30 years of practice who have a lower risk in terms of their surgery. They have a much better experience because the surgery is not as difficult. Their recovery is faster. And those are the kids that are in their teens, you know, between 15 and 20. The average teenager just sails through the surgery. But you can't say that for a 35-year-old. In fact, you probably need to tack on an extra day or two for recovery for someone in their mid-30s, much less trying to do it at 50 or 60. So I can't imagine being a British oral surgeon with my average wisdom tooth patient being 35 years of age. I think I'd have to find something else to do. So anyway, I thought I'd pass that along. I do want to pass along to the parents of teens that it's best to start looking at the age of 15, although sometimes I've found 15-year-olds have fully formed wisdom teeth. I've found 19-year-olds with wisdom teeth. The roots have barely started to grow, so there is a variation. There is no one age to recommend, but if you start at 15 with a panoramic X-ray, you can at least determine how well they have matured and decide when is the best time to remove them. And for me, it is by all means before the roots have finished growing. And if you can catch them when the bone of your teeth is soft versus doing it 5 years later at 20 or beyond when it's much, much harder, if you take advantage of both of those factors, then it's way in your advantage. Y'all have a good weekend. I've enjoyed myself spending these few minutes with you. Talk to you again.